Hi, this is Dr. Michelle Brown-Echerd. I'm a naturopathic physician, and I'm doing an update video. I have not really posted many videos on the Tower of Health website or on YouTube for Tower of Health, and I'm using this light here. Excuse me, it's so dark. I'm so backlit. Um, I'm currently licensed in 3 states as a naturopathic physician. In Maryland, I can call myself a naturopathic doctor. I am the same person. I have a similar job. There are some restrictions on most pharmaceuticals in the state right now, which they will be voting on in October of 2020. I'm also licensed in Washington State and in Oregon, which I'd been licensed in Oregon since 2015. I graduated from, at the time, NCNM, which is now National University of Natural Medicine, and I also have an additional certificate in naturopathic midwifery. I'm also a certified doula, and that's for birth and postpartum. I did study some Chinese medicine, but as some of you may know, as a single parent raising my children alone, it was very difficult to try to do naturopathy and Chinese medicine and midwifery. And then for midwifery, I was on call for 24 hours a day, 7 days a week for 2 years. And that was during school, during the last year, maybe a little less than a year. It's hard for me to remember now because I did start births in 2013. I believe it was the very end of 2013 during winter break that I started attending births, which actually was at OHSU Hospital, which is Oregon Health and Sciences University. I am licensed and able to accept new patients in all 3 states. I do have the ability to do telehealth. I do have the ability to do in-person visits. I have the ability to do some telephone consults as well. There are other states after this national disaster that are directly, individual, state by state, are accepting different practitioners' credentials for expedited license. I did receive an email from Washington State saying that I could, if I was licensed somewhere else, that they could have me work in Washington State. I already have a license, which is the reason why I got the email, because I'm on their email list. So I did not need to go through that. I was thinking about how practitioners would practice across state lines, especially with telehealth, or like me right here, I'm close to DC, I'm close to Delaware, and I'm close to Virginia. Very close. I think within an hour, within an hour or less, I believe I can be in one of those districts or states. I have not yet been to Delaware. I was thinking about going to Delaware, but now we're in shelter in place, so I'm not going to do that right now. I was actually going to do some doula work there, and that person did not contact me. The drive would have been quite long because it was on the beach. So I'm open to different levels of care, and the doula work, whether that's home births, whether that's hospital, that's a little tricky right now. And then the naturopathy, both can be done through telehealth using an app such as DoxyMe. VC is another option. There also are ways to do secure messaging and to do paperwork via the internet that is secure to protect your personal information and to sign paperwork. I am credentialed with several insurance companies in Oregon. And in Washington, I believe that I'm out of network with Blue Cross Blue Shield. I do need to look at some of that paperwork. I did come from an urban environment, and I am now in a rural environment, and there are a little bit of my own personal technical things, as partly because I traveled on an airplane with a bag. Like, I was not able to bring all of my office stuff. So there's a limited amount of personal protective equipment. There's a limited amount of office equipment that I actually have out here because my home base is still in Portland, Oregon. Um, and like I said, with the insurance credentialed already in place there, I will do what I can this week to make a list that's easier for both you and I to read. I had mainly been seeing Medicaid patients, not mainly, but 100% Medicaid patients, which don't always pay me. So there are some situations where I can do that consult, have you look, contact your insurance company. There's so many changes right now with allowing certain types of visits, such as a telehealth, that may or may not have been in place before, or you may have needed to go to a certain company that provided for like ABC insurance. Um, right now, I haven't done a lot of advertising. This whole coronavirus has occurred. I wanted to say started when I got out here, but I'm not. I'm not certain I know exactly when that started. People are saying December 2019, and I had come out here more long term for November 2019, and like I said, I still have my home base in Portland. Um, there's so many changes with the government rules, and having been a primary care physician in Oregon who did prescribing, who ordered lab tests, I could draw labs, ordered imaging, x-rays for different clients, referred clients to specialists. I had that at my fingertips with my electronic health records. It's a little bit different out here. The licensing here has only been for 2 years. Now, what does that mean in Maryland? What is a naturopath? Well, people say, well, it's not like you do wound care. Well, it's not like you see patients about this, that, or the other. And that's what I keep hearing from certain people. And it's like, well, actually, I do all of that. And even if I don't do all of that, especially with telehealth, I've been trained to do all of that, and I've done all of that. And I'm saying that, all of that, without clarifying. In Portland, in medical school, with patients, I have delivered babies out of hospital. Around 50, I believe, were out of hospital. 50 started out of hospital. We did the practitioner I shadowed did send approximately 20% to her patients to the hospital, not the emergency room, but to the hospital. Now, there's different things. There's different reasons. There's fatigue. There's just, you do everything you can and you're at 41 weeks and you don't want to take a chance. There's different reasons. Sometimes we've had some very petite women that were not standard American. They were immigrants. They were very petite. They had measured low at their ultrasound appointments, and they were like pretty much detained at the hospital. So in those situations, I want to say started about 50 births. 10 or more births I had participated in at the hospital on purpose. They started there, some in the operating room, some twin births, high risk births, and the home births. It's not just, hey, someone's going to come to your house and deliver a baby. It's, hey, you found out you're pregnant, you hired this practitioner. I was a student under that practitioner, and it's like we became family. So some people don't want that close of a contact with their practitioner, and it's like I'm one person. I want to lump all of my certificates and my degrees. You know, I'm also a notary public. I'm also got a OLCC, which is a liquor license in Oregon to distribute adult beverages. I don't drink. I was able to do that for one of my jobs. And why do I have so many jobs? If you've gone to medical school, it's expensive, and not everybody pays out of pocket. That's why until I can pay off my loans, there's no too busy with working. Unfortunately, I have not been paid adequate amount in cash and or with insurance. But thinking about preventative medicine, botanical medicine, supplementing herbs, diet, lifestyle, such as, what's your food habit, what allergies may you have that you didn't know you had, what allergy testing have you done that may or may not be accurate. Physical medicine, similar to chiropractic adjustments, but we are only allowed to call them naturopathic manipulation therapy. We cannot call them chiropractic adjustments. We were taught these naturopathic manipulation therapy by chiropractors for many years. Starting, I believe, first year, my regular program was 5 years long, and I did 1 year of physical medicine with Dr. Augusta, who is also a physical therapist. So we spent a lot of time giving physical therapy, so-called prescriptions, exercises, and it's good. It's really good to be well-rounded. Homeopathy. Some people believe in it, some people don't. There's a lot of people that do not prescribe homeopathy the way that the original creators or prescribers, hundreds of years ago prescribed it. That can cause a lot of issues with it not being effective. Some people may not even want to consider that. Some people have considered it and seen it day or night. Some people believe that it's a placebo, that it's a sugar pill. If it's a placebo, did you know, this is not my belief, but placebos can have been shown to increase people's health because they have this inner belief of healing. That's not what I'm saying about the medicine. There are a lot of laws changing from the FDA where they're going to be more strictly regulating and making it more difficult for us to receive homeopathics. I need to look more into this because this has been a very important part of my life, especially someone who has a lot of allergies and doesn't want to take a lot of medications, including supplements. That's just my own opinion. Everybody can talk to their practitioner, or if you have a practitioner who does not do homeopathy or botanical medicine or supplements, then you can find somebody to refer you to somebody in your area, or nowadays telehealth, who will take you as a patient and you can ask more questions. Many times, such as myself, you can do a 10-minute consult, 10-minute phone call to see if we're a good match. I've had certain insurance, and including Medicaid, where I've gone and I've paid even $600 a month, and I've seen a practitioner and it didn't work out, and it's like pretty much I was assigned that person. I didn't get to pick and choose. What's interesting about Medicaid in Oregon is you can pick your primary care practitioner and or supplemental care if you are having chronic conditions that require a lot of hospital stays. I do not own a hospital yet, so I would not be able to provide that care. I have been invited to go to many hospital appointments with patients. Unfortunately, I had different jobs and I could not do that, but that was very, very well appreciated to feel that. As the patients knew that I understood their health for both my care and the care that they were receiving at their hospital and or clinic. Everything about minor surgery is a little bit confusing. A lot of in Portland, I do have everything to to suture a wound, to remove the sutures afterwards, injections. I do not do, and I believe in Maryland, I need to double check. The rules they're voting on in October do have overlap of things that we're already able to do. Like I said, we're trained, we're able to do that in Oregon, but we're not necessarily able to do that in every state. B12 injections, I'm not sure that I can do that right now, but I believe that it is very important, as I was telling a colleague, to have a crash cart. We did do things extremely carefully in medical school. So what we would do for B12 would be to put a bleb on the back of the hand with a needle and syringe of B12, and we would wait about 20-30 minutes to see if that person, we're medical students doing this on each other in lab, and see if that person had a reaction to that. Any hives or swelling or anything like that. And I think in our class, none of us did. And, I get a little bit nervous having the corn allergy and different things about what things like such as vitamin C is derived from oftentimes corn, different things like that. Ascorbic acid, another name for that. And what we feel like, especially as colleagues discuss, hey, you gotta be aware of this. Thinking about if someone were to have allergic reaction, because someone somewhere in the world, most likely every substance that are allergic. I mean, there's people that have allergic reactions to sunlight and to water. So to have an oxygen tank and to have epinephrine. And some of these items I do have in Oregon, but like I said, I came out here because of the national emergency. My plan was to go back and decide if I wanted to bring stuff back and forth on an airplane or in a car, or just duplicate myself out here as far as medical tables. And I have hydrotherapy. That's something I didn't talk about. Hydrotherapy, similar to what chiropractors use, electric stim machines, water mixed with electric stim feels like a little tingly massage or hot tub feeling with the jets on. So going back to Maryland having been licensed for naturopaths for 2 years. So a lot of times there's states that just haven't had a lot of naturopaths in the state. So say there's a state called, I don't know, we'll name it Mia's Fairy Island. Like, we'll just name it that. And say there's a lot of people, and a naturopath comes to town. This naturopath is licensed in Oregon, and they move here, and there's no licensure. That pretty much means that I did the minimum of 4 years of a graduate medical school. I did pass. For me, I did 3 board exams, but for the regular naturopathy, not the birth, 2 board exams. Successfully completed any of the background checks, the FBI fingerprinting, supplemental questions about your character and or your habits and or any addictions, arrests, complete all of this paperwork. I feel like I'm forgetting something about the education, because in order to also be accepted into medical school, you do need a bachelor's degree. And if you have a bachelor's degree, a bachelor's in arts or something like that, you just need to add all of the basic science classes. So I went to a university because they had more options in the days and times of the labs versus the community college in Portland is all spread out, and things were just little bits here and the classes filled up. So I just threw myself in a kind of an overcrowded situation. It was not what I necessarily wanted to do, but that's what got the job done, considering that I had children in school that needed rides for me and care for me that didn't include me going to class and lab on Saturdays or on Thursday nights or whatever may happen when you don't have a babysitter. Those classes are prerequisites. Most likely, a lot of times the program you would sign up for the school would be pre-med if you already have a bachelor's degree like I did. Some of it, I wanted to be a medical doctor. I did already take most of my basic science, but it was in the 1990s. Because that's how old I am. So I did need to retake a few of those classes. Some of them I bumped it even one notch before, and I just started biology at the beginning. Did I need to do that? Maybe, maybe not. It's hard to say. I was right on the edge. A lot of my classes, they said it was, you had to have them in 6 years. It was like 7. I had stayed home and had my 2 children and did not apply to medical school when they were infants. So that pushed me back couple more years, but I'm happy I did it. I'm not happy about the money I borrowed to do that, but I'm happy to just get back into school. The science books change almost every year, if not every 2 years. There's stuff added, there's stuff deleted, there's stuff changed in the world. Is Pluto a planet or not? So during those classes at Portland State University in Oregon, I was pre-med. That program also had a formal name for if you wanted pre-naturopathic medicine. It wasn't a certificate program or anything, so it's really hard to say that I went to that school for 4.5 or 5 years and didn't have it. I mean, I was 12 credits from a general science degree, which was kind of, I kind of wish I had gotten that. There's a lot of, I took the classes, but I probably could have transferred some credits. I didn't even think about that, but it's okay. It's okay. I took the classes, so if I wanted to apply for a job in a lab or as at a um, chemistry teacher, I could state what I took, and I do have a bachelor's in science. Anyways, most of your classmates at the time I was at school were pre-med. A lot. Most of them were pre-med. Um, I was classmates, group mates with someone who was, she wanted to do plastic surgery. There are also people that are pre-dental, and some of those people are already dental hygienists. So it's like chemistry, physics, biology, psychology. I don't think you needed both psychology and sociology. I think you could choose. There's this regular classes. I don't know how to say it. I mean, I took yoga, I took taekwondo, I took aikido for physical and mental health, and I did several women's studies classes, which is quite interesting. I should look at my not my degree, but my transcript. I did several women's studies classes. They actually had some women's studies scholarships that I considered applying to, but it's hard. It was hard to just get the homework done and get the kids out of daycare on time. So going back to the licensure, Mia's Fairy Island. So I have our degree. I have my degree. I am not all people that call themselves naturopaths, like especially in unlicensed states, they might have a correspondence course they did online. They could call themselves naturopaths, which is interesting. Because we at that school in Bastyr, there's one outside of Seattle, one in San Diego. There's Connecticut, there's a school, there's one in Illinois. There's a Southwest Naturopath School in Arizona. There's at least 3 accredited, if not 4, in Canada. And there is one in Puerto Rico, but I'm not sure if I did Puerto Rico. I think my package is here, by the way. I could do any other state here. But I have a teacher who taught in Puerto Rico. Let me check and see if my package is there. I believe that it is. Nope, it's somebody else outside. So I feel like I feel like I do need the light. So this is not true. So you could check someone's credentials. You can look them up online. You can look up licenses to see if they're in good standing. See if they're retired or what's just the other word? Take a leave of absence where it's an inactive license. You can see if they have any sanctions against their license. If you want to look somebody up, their full name for their state, that's public information. If there are any sanctions, some of them from the past are posted as a judgment, as a PDF that you can read. I've almost worked with somebody that had some of those, and it was very uncomfortable, and I'm glad that I saw that before I signed any paperwork. And it's sometimes it's just a matter of a slip up. It's not something they went in, they were negligent, or sometimes it's a slip up. Sometimes it is a repeated pattern of somebody trying to get away with something, and that's what you can look up. After so many years, I believe that those are no longer just posted on the internet, but you could get a copy from that person's board. Some people might be MDs and naturopaths. Some people might be chiropractors and naturopaths. So there's several people like that. There's many more probably that are acupuncturists and naturopaths. And I started that route. I did not finish because of the time constraints. There's different types of acupuncturists. There's LICs, there's MACs, there's masters in acupuncture, which I get a little bit confused, but there is a doctoral level, and so the letters behind the name, please forgive me. I've gone to acupuncturists, and I usually almost always get results. I see results. I notice results. My body responds. There's one that I did not respond, and that person is like a guru around the world, and I find it interesting. But I feel my energy doesn't always match up with others, just like massage, even if they're gurus and they have a very successful practice. Back to the island of Mia. You can look and see And that person doesn't necessarily need a license in one state to be licensed. I think that is my package for real now. In another state, I'm just gonna let it go. I hear the package coming. I have some food from Vitacost. I'm pretty sure that's my package. Anyways, you don't have to have that. It just means that you don't have a board to monitor you and to fill out your paperwork and to send your certificate and count your continuing education. But once there's enough interest and people call for it, then you do it. You get licensed. You may start with it a little bit where you can't do so much. You may have DOs and MDs saying they should not be doing that much. You may have people put you at a level of a physician assistant saying you need to be working under someone who's going to monitor your practice. Different rules for different states. But ultimately, when we were trained in the North America, Canada, and US, we were trained as primary care physicians. A lot of people want to do specialties. Some people were complementary medicine, but we wanted to be here. Like for the coronavirus, we wanted to be here. But we're not being treated equally, we're not being paid equally, and we're not necessarily being seen by the patients as equal. And we're not equal. We do a lot different, a lot more. And there's stuff that we do since we're not necessarily organ surgeons or heart surgeons or brain surgeons. There's a lot of stuff we don't do unless we have two different certifications. I'm going to get my package now. Adios.